Hi, I'm Herb Cohen. I want to talk today about the disease model and how the disease model doesn't just affect us in the medical community, it affects substance abuse, mental health, and even our justice system. And we're going to look at how this works and how it's actually creating a systemic failure. So the disease model is a model where diseases are labeled by their symptoms, and the treatment then is designed by treating the symptoms, usually with medications. So we're treating symptoms, not the cause, and that model in the medical community doesn't have as higher success rate as if we were to go after a causal approach. So sometimes it actually causes more problems and costs more money. So for example, if we look at something like chronic pain, chronic pain is treated with opiates, which are addicting, and people who have chronic pain have an emotional side effect of being in pain all the time as you get depressed. It's hard to feel good when we are in physical pain, so we get depressed. And the side effect of medications, of opiates, is depression. So here we are compounding the problem with the treatment of the symptoms instead of looking at a more causal approach, which might be how do we fix this chronic pain? How do we get this person out of chronic pain from a causal viewpoint? Another example would be migraines. Migraines, treated medically, have a side effect of the medications being iatrogenic. What that means is that if we were to stop taking the migraine medications, the migraines would be worse in that they'd come back stronger and last longer. So we have a medication treatment for migraines that is making us dependent on those medications, or else we will have a worse condition than we started with. This is a disease model. Sometimes medications, like statins for example, have side effects that we have to take other medications to offset the side effects. So side effects then cost us in terms of our health being compromised, but then they cost us again because we have to feed the pharmaceutical meter by buying other medications to offset the primary use of those medications to begin with. So we end up with more pills, more side effects, and more medications, and the only person that benefits is the pharmaceutical industry. They benefit all around from the disease model. In fact, the disease model is perfect for them because they design medications to treat symptoms, but actually never to cure anything, because that would take them out of business. Someone who stays sick requires medications for the rest of their life, hopefully, as far as the shareholders are concerned, and this way they have a constant flow of income. A perfect example of the Narcan pharmaceutical drug for a disease model, we have to come to substance abuse for that. In substance abuse, opiate addiction, heroin is a short-acting drug, so it really has a short life, and that makes it easier to become unaddicted to from a non-pharmaceutical perspective. I do EMDR for heroin addiction. In one session, we can switch off that addiction. However, if we take a pharmacological approach, treating the symptoms in a disease model, we would give people Suboxone. Suboxone is a combination of buprenorphine, an opiate, and naloxone, and it has naloxone in it. So the naloxone is an opiate blockade, and that is combined, that's like a 40% blockade combined with 60% buprenorphine. So what happens is people become addicted to the buprenorphine. The purpose of the buprenorphine is to stop withdrawal from heroin. However, they become addicted to the buprenorphine, and the naloxone actually blocks the switch in the brain that allows us to switch off addiction. So incredibly, when I have people that come to me on Suboxone with EMDR, I can't switch off their dependency because it's blocked by the naloxone that's within the Suboxone. So here's a drug that actually is preventing people from getting off of it. And now there are lawsuits where people, as a class action suit against the makers of Suboxone, because they've really mismarketed this drug as basically an end-all for addiction treatment, and people can't get off this drug at all. It was meant to be a short-term drug. It was marketed to be a short-term drug, and it's not. It's a lifer. So this is a pharmacological gold mine for people who are the recipients. It is a disaster. And I have heard about people in waiting rooms at pain management docs getting their scripts, and it's filled with people who look like zombies. They're drooling and they're staring straight ahead because they're on such a high dose of this stuff because they've created tolerance, and they're emotionally completely vacant. And this is not living. This is not how we want to answer addiction. So this is a disease model example. Now, other disease model examples are using antidepressants, for example, in mental health for depression. So there have been studies. For example, Daniel Amen of Amen Clinics has done a wonderful study showing how after scanning 300 depressed people's brains that using SPECT scans, that he got 7 different brains, not all of which were serotonergic, which means that the primary treatment in the disease model is using an SSRI or an antidepressant. These drugs are not even indicated in all the people with depression. Yet that's what's prescribed. That is the treatment. And a study was done where we asked people, if you're depressed, if you're an outpatient and you're taking an SSRI, are you depressed? Well, out of a huge sample of people that were surveyed, the result was 30% said, yes, I'm no longer depressed. So 30% remitting depression is the same as placebo. Not better than placebo. Now, drug companies have to submit their initial designs to beat placebo, which the drug companies have done. But in a controlled setting, inpatient, not outpatient, not in the real world, in a very, very controlled environment. They also negated to determine whether people who were saying that they lost their depression on the medication were actually having a placebo effect or not, as that group is a separate group and would have its own placebo effect. When I asked pharmacy makers about this, they said they weren't required to do this by the FDA, and that's a fact. They're not. And the FDA still has given them a full indication to work as a antidepressant, even though these new studies have come out showing it's no better than placebo. Yet people are spending billions and billions of dollars taking SSRIs, and 60% are finding them ineffective. Only 30% are finding them effective. This is the disease model as opposed to a causal model, which would be finding out why people are depressed. Lo and behold, when we ask, we find out there's a reason, sometimes a very good reason why people is depressed, and that's fixable with non-pharmacological processes. We can fix it and eliminate depression. So, and going back to Daniel Amen, we can see through his scans that not all depression's the same. Let's go back to that justice model now. So we have an answer for people breaking the law. It's called prison. We have a prison system that has many different levels to it. And I'm going to talk about the local level. I'm not going to talk about state prisons for hard crimes. I'm not talking about anything violent, where people are really hurt another person. I know there's no good answer for that, and people do have the consequence if they've done something wrong, going to jail. The idea of jail is to discourage people from committing these crimes in the first place. However, what we found is that it doesn't really work that way. That's not how it works. Locally, our county sheriff in my region, I used to be on this committee called the Coordinating Council, the Justice Coordinating Council, and sitting in on these meetings, we got to participate in tours of the jail, meetings with the warden, and understanding why people were in jail and what was the recidivism rate. Well, believe it or not, the recidivism rate was 90%. 90% means that the same people that were there last year have come back this year, and the year after, and the year after. The warden says, I know them all by first name because they're always there. So people are not learning a lesson from being in jail. They are not learning that punishment is going to make you not want to come to jail again. They're committing these crimes over and over again, and jail is not acting as a deterrent. Jail itself doesn't act as a deterrent. This is treating the symptoms. We're treating the symptoms by throwing people in jail. It's a knee-jerk reaction. It's not looking at why they're in jail. So we asked the warden, why is these people in jail? And he said 90% are for drug and alcohol reasons, crimes related to drug and alcohol use. Well, we have drug courts. So the drug courts send people to drug treatment. Drug treatment is treating the symptoms, where we have an 80 to 90% relapse rate. Thus, we have a 90% recidivism rate in jail. This is the disease model. This is systemic failure at an astronomical cost to us, the taxpayers, and to the person who is part of this system, who's cycling in and out with no help at all. No one's really looking at what's causing this person's distress, that they need to medicate drugs. They're not getting treatment where we can switch off their dependency and treat the traumas that have caused those dependencies. Working from a causal model, we would save billions and billions of dollars and give people back dignity and a life that they can live, not behind bars. I hope that this gives you some food for thought and can bring some change systemically to our medical community in terms of research. We need research dollars away from drugs that are going to just cause more problems. I know in mental health they're researching ketamine, microdoses of ketamine, MDMA, and now we have medical marijuana. We can have people on a cocktail, and wow, yeah, they won't feel their trauma anymore. You know, this is just ridiculous. We're going to get people so high on drugs, and this is how we're going to treat trauma. There's a better way, folks. I'm telling you. What we're doing with EMDR, sensory motor therapy, hypnotherapy, there's so many techniques that are so effective that require zero pharmacology, that work on a causal model. This is the direction our country needs to go in. Well, I hope you give me some feedback on this, and I hope that this is food for thought. See you again soon.